When it comes to Medicare Advantage, one plan does not fit all, and that's where most people make their biggest mistake. Every year, millions of Americans choose a plan based only on brand names or national ads, but what really matters is how that plan performs in your specific state. So today, we're going to break down how you can find the best Medicare Advantage plan based on where you live, using the newest 2026 updates, CMS Star Ratings, and regional coverage changes. Before we dive in, comment your name and the state you live in. I want to see where everyone's tuning in from and who's planning smart for Medicare season. Let's see which states are winning when it comes to great coverage and which ones need to make a switch in 2026. Now, let's get into it. Medicare Advantage, also called Part C, is run by private insurance companies that contract with Medicare to provide your hospital and medical coverage. But here's what most people miss. The same company can offer totally different quality plans in different states. A plan that's rated 5 stars in California might only be 3 stars in Texas. That's because networks, provider availability, and state regulations make a huge difference in how your plan actually performs. In 2026, the Centers for Medicare and Medicaid Services, or CMS, released the latest star ratings, and there's a big shift happening. UnitedHealthcare and Humana still hold the largest market share, but there's major movement from Aetna, Blue Cross Blue Shield, and even some regional players like Kaiser Permanente and Highmark. The key takeaway, depending on where you live, the best plan might not be from the biggest brand. For example, if you're in Florida, Humana and UnitedHealthcare continue to dominate with their PPO and HMO plans offering strong benefits like dental, vision, and gym memberships. But Kaiser and Aetna are closing in fast in several urban counties because of their better customer satisfaction and easier access to specialists. If you're in Texas, the 2026 numbers show Humana dropping slightly in star ratings due to network complaints and delayed authorizations. Meanwhile, Aetna and Blue Cross Blue Shield of Texas picked up momentum with new supplemental benefits, including flex cards and improved prescription coverage. In California, Kaiser Permanente remains the gold standard with 5-star ratings in multiple regions, especially Northern California. Their care coordination and member satisfaction scores remain unmatched. UnitedHealthcare performs well in Southern California but lags behind Kaiser in preventive care and mental health coverage metrics. Over in New York, there's an interesting twist. Some smaller, regional Medicare Advantage plans like CDPHP and Excellus Blue Cross Blue Shield actually outperform national carriers on customer service and claims accuracy. That means New York residents often get better value from local plans rather than big nationwide ones. Meanwhile, in the Midwest, especially Ohio, Michigan, and Illinois, Anthem Blue Cross and Aetna are standing out. These states benefit from large provider networks and relatively stable premiums, making them reliable picks for seniors who want consistency without big annual surprises. And if you're in states like Arizona, Nevada, or Colorado, UnitedHealthcare's new 2026 lineup offers expanded fitness, grocery, and utilities benefits for certain chronic condition plans. But Cigna has also entered these markets aggressively, introducing low-premium options with high prescription coverage ratings. If you're finding this information helpful so far, make sure to like this video and subscribe to Carewise. We post daily updates on Medicare, Social Security, and retirement planning so you can make smart choices and stay informed before open enrollment. Now, here's something most people don't know. CMS Star Ratings aren't just about coverage, they reflect member experience, access to care, and complaint handling. So when a plan gets a 4 or 5-star rating, it means it performs better in how members are treated and how quickly they get care. But star ratings also change every year. In 2026, about 36% of all Medicare Advantage enrollees are now in a plan that dropped below 4 stars, mostly due to new quality measures on preventive screenings and chronic care management. For example, Cigna's Medicare Advantage plans saw dips in several states due to delays in prior authorizations and lower preventive care scores. On the other hand, Aetna has made major improvements in customer satisfaction and telehealth access, boosting their overall performance in 2026. Let's go region by region for a closer look at what's trending. In the Northeast, Kaiser and regional Blue Cross plans remain dominant. States like Massachusetts and Pennsylvania favor plans with integrated care networks, meaning your doctors, specialists, and hospitals all share data, leading to faster and more coordinated care. In the South, especially in Florida, Georgia, and the Carolinas, Humana's Advantage plans are still strong but facing increased competition. WellCare, now owned by Centene, has expanded aggressively in these states, offering rich dental and vision benefits, but their satisfaction scores remain mixed due to customer service wait times. In the Midwest, Anthem and Aetna's newer PPO plans are shining. These plans combine broad provider access with no referral flexibility, which seniors love. UnitedHealthcare remains steady but slightly less competitive on monthly premiums in rural counties. In the West, California, Oregon, and Washington show Kaiser continuing its leadership, while UHC and Aetna try to catch up with expanded provider contracts. These states tend to reward preventive care, so plans that cover wellness programs and mental health get higher scores. In mountain and rural states like Idaho, Montana, and Wyoming, local and regional carriers are gaining ground. These markets often suffer from limited networks, so insurers offering telehealth and flexible out-of-area coverage are the ones seeing the biggest jumps in satisfaction. Now, when we talk about the best plan, according to your state, it's really about matching your needs to what performs best locally. A 5-star plan in California might not even be available in Tennessee. So here's the golden rule: always check your county-level plan performance on Medicare.gov before you enroll. Another important factor is network stability. In 2026, UnitedHealthcare made headlines by exiting certain underperforming Medicare Advantage markets due to cost pressures. This means if your state relied heavily on UHC before, you might see fewer options this year. On the flip side, that creates openings for companies like Aetna and Humana to expand their presence with competitive benefits. And then there's plan type. HMOs are great if your doctor is in-network and you want lower premiums, while PPOs offer flexibility if you travel or live between states. Some newer plans in 2026 are introducing HMO-POS hybrids, which give partial out-of-network coverage, perfect for snowbirds or retirees who split time between two homes. Drug coverage is another big differentiator. CMS's 2026 Part D changes have made formulary quality more important than ever. Some states now favor carriers that include insulin and common chronic medications at $0 copays. Aetna and Blue Cross have been leading this trend. So, which states are seeing the best overall plan performance in 2026? Based on current data, California, Colorado, and Massachusetts top the list for quality and satisfaction. Texas and Florida have mixed ratings but strong competition, keeping premiums low. New York and Pennsylvania benefit from diverse local carriers with great customer service. Midwestern states like Ohio and Michigan see balanced options from Anthem and Aetna. Southern states have lower star averages overall but improving benefits due to WellCare's expansion. But here's the catch: best doesn't always mean best for you. If you take multiple medications, have specific specialists, or travel frequently, your personal best plan might be completely different from your neighbor's. Always compare the plan's provider directory, drug formulary, and extra benefits before enrolling. And remember, every year, star ratings reset. What's a 5-star plan today might not be one next year. So always check October CMS updates before you lock in coverage. If you're serious about getting the best Medicare Advantage plan for your situation, take 5 minutes to look up your zip code on Medicare.gov, check plan ratings, and compare benefits side by side. It's the easiest way to see how your state ranks, and which companies are improving or declining in your area. We've seen massive shifts this year, and it's only the beginning. As insurers adjust to new CMS rules and healthcare costs rise, the 2026 season could be one of the most competitive yet. So don't just trust national commercials, trust the data and your state's performance. And if you found this breakdown helpful, Don't forget to like this video and subscribe to Carewise. We bring new Medicare updates every day to help you make smart choices for your retirement and health coverage. Before you go, check out our next video on the 5 worst Medicare Advantage plans for 2026, because knowing which ones to avoid is just as important as knowing the best ones to choose.